Disorders of urination, even if their causes are not harmful to the body, significantly reduce the quality of life. Pain, burning, and other unpleasant symptoms can be agonizing, and one would want to get rid of them as quickly as possible. What causes disruptions in the functioning of the urinary bladder, and how are they related to the prostate gland? We'll discuss this in this video and, at the end, provide a recipe to protect and strengthen the health of these organs. What are the diseases of the urinary bladder? What causes them? What influences the health of the prostate gland? How is this organ connected to the urinary bladder? What does traditional medicine recommend? Bladder diseases. The urinary bladder is a cavity located in the lower abdomen that expands as it fills with urine and contracts during urination. Its function can be disrupted due to various infections and other factors. Here are some common bladder diseases. Cystitis. This is an inflammatory condition of the bladder, often caused by a bacterial infection. It is characterized by pain during urination, frequent trips to the restroom, and sometimes fever. Bladder stones. The formation of stones in the bladder or urinary tract occurs due to the accumulation of salts in the body. These stones can cause pain, blood in the urine, and difficulty urinating. Urinary incontinence. This condition occurs when a person cannot control urination. There are various types of urinary incontinence, including stress, psychogenic, and mixed incontinence. Acute urinary retention. It can be caused by urinary tract obstruction, inflammation, or other factors. Bladder cancer. Bladder cancer is a malignant condition where cells start to multiply uncontrollably in the bladder. It can lead to blood in the urine, pain, and changes in urination frequency. Bladder papillomas. These are benign tumors, but they can cause bleeding and discomfort during urination. All these bladder diseases are linked to the function, structure, or health of the bladder itself, as well as the urinary tract. They manifest with similar symptoms, such as lower abdominal pain or discomfort, frequent urination, and the presence of blood in the urine. What determines bladder health? The health of the urinary bladder depends on several factors. One of the primary and most important factors is hygiene. Adhering to hygienic norms, including proper genital care and cleanliness, reduces the risk of infections. Secondly, adequate fluid intake helps maintain normal bladder function. Moderate drinking helps avoid excessive strain on the organ. The third factor is diet. A diet rich in dietary fiber and nutrients supports bladder health. Limiting spicy foods, caffeine, and alcohol also reduces the risk of irritation. Regular physical activity is important for maintaining bladder function. However, certain types of exercises, especially those involving excessive pressure on the bladder, can have a negative impact. Tobacco smoking increases the risk of bladder diseases, including cancer. Previous infections and other urological issues also affect the bladder's overall resilience to various illnesses. Genetics plays a significant role in bladder diseases. With age, the bladder can undergo changes, increasing the risk of various conditions such as incontinence or bladder enlargement. The seventh group of factors is related to a person's profession and living environment. Exposure to chemicals or other workplace and environmental factors can significantly impact bladder health. And, of course, chronic diseases such as diabetes and obesity, as well as other medical conditions, have a detrimental effect on bladder function. What affects prostate health? The prostate gland is an organ of the male reproductive system that surrounds the beginning of the urethra and plays a role in producing the secretions necessary to support the viability of sperm. When blood circulation in the pelvic area is compromised, the prostate gland becomes vulnerable to various infections. This is the primary cause of prostatitis. However, even without acute signs of infection, this condition can develop. In such cases, the gland may swell, and its secretory function may be impaired. This often leads to pain in the groin and urinary disturbances. Chronic enlargement of the prostate gland is known as adenoma. Men over the age of 40 are at risk for this condition. The most serious prostate condition is prostate cancer. Prostate cancer can be asymptomatic in its early stages, but later manifests as difficulty urinating, pain in the pelvic region, blood in the urine, or semen. To diagnose and treat prostate conditions, it is essential to consult a urologist. Regular medical checkups can help detect problems at an early stage and develop a treatment plan. How are prostate diseases related to bladder function? Prostate and bladder diseases can be interconnected because anatomically and functionally, these two organs are closely situated and interact closely. Enlargement of the prostate gland can exert pressure on the urethra, which passes through the prostate. This can lead to difficulty urinating, weakened urine flow, a feeling of incomplete urination, and urgent trips to the restroom. Inflammation of the prostate gland, prostatitis, can cause pain or discomfort in the pelvic area, which also affects the bladder. This results in frequent urination and other symptoms related to bladder function. Prostate cancer, especially in its advanced stages, can also put pressure on the urethra or bladder. Surgical interventions to treat prostate adenoma can impact bladder function as they directly affect the patency of the urethra and the bladder. How is the bladder and prostate treated in folk medicine? One of the simplest and widely used remedies for maintaining bladder and prostate health in folk medicine is onions. Firstly, onions possess antibacterial properties and help combat urinary tract infections. This can be beneficial in cases of certain bacterial infections of the bladder. Secondly, onions contain antioxidants that are essential for protecting cells from damage and inflammation. This can help reduce inflammation associated with some bladder and prostate issues. Thirdly, onions contain sulfur compounds that have a positive impact on blood vessels and improve circulation. This can be helpful in maintaining prostate health. How to use onions to combat infections and bladder dysfunction. To do this, you'll need 3 large onions. Remove the skins from them, wash them thoroughly, and soak them in 600 milliliters of water. Boil this mixture for 5 to 7 minutes. Then strain the decoction, let it cool, and add 1 to 2 teaspoons of honey. Drink this mixture 3 times a day, 100 milliliters each time. The treatment course is 5 days. The onion skin decoction improves the tone of the bladder muscles and has an antiseptic effect on it. The onions from which you removed the skins are also worth using. Finally, chop 2 onions and soak them in 600 milliliters of boiling water. Cover with a towel and let it infuse for 2 hours. Then strain it and add 1 to 3 tablespoons of honey. Drink this mixture 50 milliliters once a day after a meal for a month. Grate the remaining onion on a coarse grater, squeeze the juice from it, and mix it with a tablespoon of honey. Drink it 2 hours before bedtime. The comprehensive use of these remedies will not only benefit the urinary system but also strengthen your overall immunity.